Well, I guess it's almost, if you talk about it, it's almost like the environment the bones are sitting in. So just like if you were trying to nurture a plant, you would look after the soil and the environment and that kind of thing.
Exactly, exactly.
What role does kind of posture and that kind of thing play? And I'm curious as to when you're working with someone, how you know what moves to do with them and that kind of thing.
Well, I mean, Tom Bowen himself was a really, really good at observation. So he could apparently go round a waiting room of 20 people and saying, oh, it's, your back problem is related to your neck, or the other way around, or, this problem is actually coming from here, or whatever. He was very good visually, and some people are better like that. I'm better hands-on, and I tend to feel things more hands-on. So whatever skill that the practitioner has, but yeah, you are using a lot of observation. So, for example, when I have someone into the clinic, I usually get them to walk up and down, so I watch how they walk. And when you do that, you can usually see, for example, if someone has, a right sacroiliac joint problem, you can see it in the way that they walk, if you know what to look for. It's not that hard. And in terms of posture, you can see, for example, if someone has what we call a head-forward posture, which is very common, where the head comes forward in relation to the pelvis. And that actually puts a lot of strain on the lower back as well as the upper back. So often, for example, someone with lower back problems, you will find they have a head-forward posture, which is affecting that. And when you begin to resolve that, their back problem gets better. So it's really crucial as a practitioner that you find out where the original cause of their problem is coming from. Otherwise, it's going to come back.
Yeah, so, which I guess can be different to where it's presenting. Yes. I mean, it's interesting because I injured myself in the gym a few months ago, and I injured myself here, but I was walking around with my shoulder like this as a way of compensating. Sure, So, what the obvious thing was the shoulder, but yes. Right, exactly.
Yes, I mean, we normally say that if you work just in the area that someone's getting pain, you're about 70% of the time you're working in the wrong place.
That's interesting.
So you really have to find out where that is. And that might be somewhere in their, fairly long way back in their history.
Okay.
If someone had an old ankle injury or an old knee accident that they got from skiing or something, and it's kind of niggling, that will obviously upset their posture, and that'll begin to affect, as you say, their body will set up compensation patterns. Right. And that has a sort of domino effect, if you like, and it might start affecting their neck or whatever it is. So you need to address all that, but then you need to address their original injury, whether it's their knee or their ankle or whatever. And you often find, for example, that people have a pelvic imbalance somehow. Their pelvis is not level, either on a horizontal plane, or it's tilted slightly. Maybe some muscles in the front or the back are a little bit too tight, or it's slightly twisted. So, and again, you can see those things. So you observe those things, and you can say, oh, okay, well, I think it's actually their psoas muscle, their right psoas is compensating for this, so we need to address that. Okay. So, it is, although Bowen might appear to be sometimes taught in terms of procedures, in fact, actually, it's very, very, very specific.
So it sounds like a lot of the art of it is the diagnosis of what's going on and what's causing it, to then know where to go with the treatment.
Yeah, and we're not allowed to diaggnose.
Okay.
But effectively,
I guess what you're doing is you're observing, right? Exactly. What's related to what?
Yeah, and we can combine that with various orthopaedic tests and that sort of thing as well. There's no problem.
And then, so that being the observing what's happening, in terms of the actual process and the actual treatment, you mentioned that you're working by making certain kind of quite adjustments, certain kind of moves on the body. How exactly does that work? And obviously, in a little bit of time, we'll see a demonstration. But just maybe just talk us through exactly how that works.
Yes, a lot of the time we're working on structures like muscles, mostly muscles, tendons, sometimes ligaments, sometimes nerves directly. And the way we do it is we might apply some pressure with our thumbs or our fingers on a muscle. So the first thing is we're going to place our hands on the body, and we can work through light clothing, it's not a problem at all. We'll take a little bit of skin slack to get to the edge of a muscle or a tendon, and we'll apply some gentle pressure onto the edge of it, so we're pushing it. And just that act of what we call a challenge on a muscle or a tendon will start a response in the body. So it starts a response through the nerves, which sit in the muscles, like the Golgi tendons, we'll call them, or the muscle spindles, the little sensory nerves in the muscle. And also it starts a response through the fascia. creates an impulse through the fascia. And that's what we're very, very interested in. So we hold that challenge maybe for a few seconds, and then we do a very gentle rolling move over the muscle, which disturbs the fascia and again activates the little nerves in the muscle. And you can feel as you work, your hands get more sensitive as you work, and you feel a response through your fingers in terms of how you're activating the fascia. And sometimes you'll feel impulses travelling very well through the body, and other times you'll feel that the impulses meet some resistance. And that's what Tom Bowen used to talk about. He used to talk about areas of the body which were effectively frozen or holding resistance, if you want. And interestingly enough, this new research on fascia is showing that fascia is by its nature liquid crystal in its nature. It's liquid, really. Like the liquid crystals in your LCD TV screen.
Yeah.
It's very, very responsive to very small electrical impulses. It'll change very quickly. So when you start to create a challenge, you begin to change it in that way. And fascia tends to respond to accidents, trauma, abuse, neglect by becoming more crystalline or frozen. And interesting, that's Tom Bowen used that very word in describing areas of the body. He would say, well, that area is frozen.
Okay.
And actually it is very much like that. It becomes more crystalline. And when you start to work on it, it's like it dissolves, it sort of lets go. It's not just a question of tight muscles, releasing. It hydrates and lets go that way and becomes more fluid. And you can feel that in the tissues, you can feel it in the skin. So it's not, you're not working on muscles in order to release them.
Yes.
You're working to get more hydration to the tissues and get these frozen areas of the body to kind of dissolve, if you like.
Well, it sounds like what you're saying is you're working more with the body rather than just on the body, of kind of imposing a treatment onto the body.
Yeah.
And what kind of conditions or what kinds of symptoms would you work with people?
Well, like any holistic therapy, it's a whole gamut, really. A lot of different things. And interestingly, different practitioners have different areas of expertise.
Okay.
Like I tend to work a lot with babies, but one of the main things with Bowen is back pain.
Okay.
And joint problems generally. So in the list of conditions that you'll see in the books or the literature, you'll see a lot of musculoskeletal problems, joint problems, like tennis elbow, frozen shoulder. And in fact, we did a study on frozen shoulder a while back as well. Lower back issues like sciatica, knee problems, ankle problems, that sort of thing. But also, it seems to work really well for certain respiratory conditions, like asthma. People have a lot of success with that, interestingly.
Okay, that's interesting.
And hay fever.
That's interesting as well, okay.
Tom Bowen's wife was asthmatic.
Okay.
So he developed certain things for her.
It's amazing how you see different links in the body. You work on one level and it affects other levels as well.
Yeah. It does. And again, Bowen is, it's very much working with the body. It tends to prioritise what the body needs at that time. But it's incredibly effective. I would say the average time for a resolution of even fairly long-term back problems, it's about 3 to 4 sessions, sometimes less. So it's pretty impressive, actually.
Yeah.
On that basis.
And I think it's also it's quite a big shift for people. This shift away from expecting some big aggressive thing that's kind of being done, and I think it's always very impressive when something spreads the way this has done through basically word of mouth and people's experiences and that kind of thing.
Yeah, it has spread massively. It's only been around just over 15 years.
Yeah. And
in that time, it's just really taken off. Not just here in the UK, but all over the place.
Yeah.
But people actually like gentle touch. To be honest, they don't really necessarily like a lot of hard manipulation. And also, when you do manipulate people a lot, it tends to kind of weaken the tissues a bit. If you get a neck and you crack it a lot, and then after a while, it can relieve pain for it can work. But if you do it a lot, it's not that great for the body to go through that. So when you obviously with Bowen, it's a completely different approach, and people do appreciate that.
Yeah. Well, having talked about it, I guess the thing now is to have a bit of a demonstration because people can actually see what it involves.
Sure.
So let's do that.
We'll do that. Yeah, sure. Thanks.